Thanks very much for Claudia for asking me to present today. So an overview of qualitative design and also touching on grounded theory in relation to its application to research in palliative care. So I think we have an hour in total, so what I'm hoping to do is probably cover the presentation in about 40 minutes, which gives us a good 20 minutes for Q&A, because I think there will be Q&A from this, and just so that the whole hour isn't dedicated towards me speaking and going through this. I have included a good few slides. I may run through some of it quicker than others, depending on the points on the slides. But I'm just trying to overall, within 40 minutes, give a flavour as to the application of both qual and grounded theory method in palliative care research. So I suppose, first of all, really, and I'm sure many people who are in this morning, maybe have different levels of expertise in qualitative research, may well have a lot of expertise already or doing qualitative research in the research. So really just to cover quickly why we use qualitative design versus quantitative design. And really it's when we want to know about the why and how. Okay, so any research questions that are very much focused on why things happen and how things happen are best addressed by qualitative methods versus, for example, quantitative research, which would be looking at quantifying experiences and looking at relationships between variables and predicting things based on stats. So quantitative research is very useful, and so is qualitative research, but they do have different purposes. And neither approach is more important than the other. They're just used for different reasons to answer different types of research questions. Qual research or qual design is really, really useful when we're very much interested, in the case also of palliative care, looking at complexities of behaviours. Okay, and obviously quantitative research does this too, but often qualitative research allows us to explore in-depth behaviours, experiences, perceptions of research participants. And it's really useful, and I'll touch on this in a few minutes when I touch on grounded theory, is it's important in often throwing up very latent experiences or perceptions that we sometimes do not take for granted. Often when quantitative researchers are used to or intending to want to measure certain behaviours or interactions or experiences, but sometimes, particularly if it's a novel area of research or something that hasn't been researched very much, or which if there doesn't exist those quantitative tools to actually measure those domains, then qualitative research is the beginning of that process. And even the most descriptive qualitative designs are often applied in the early stage phases of actually developing quantitative tools. So when we even think about the most standardized measures we often use in palliative care research, many of those tools actually begin with some degree of qualitative research. Not so much the interpretive methods I'm going to speak of as the presentation goes on, but to understand that even quantitative measures are based on some qualitative data in most cases. I think qualitative design is really important in terms of my experience of developing my skills in qualitative research. It's very useful for tracing or explaining processes, so what is going on. So when we think about that, we think about actions, interactions, behaviors, instances, and so forth. So as a healthcare professional, as a healthcare researcher, this is qualitative design is very, very relevant to answering these questions in a healthcare setting and so forth. So for example, just a question, why do people with MND resist making decisions about end-of-life care in advance? Well, that kind of question is perhaps best met by using qualitative design, because in that context, we're interested in the context, actions, interactions that explain this above scenario. And the why aspect of that question can't be done by quantitative methods. So this is just an example of how such a question would be orientate itself towards using qualitative methods to answer that research question. Not to get into too much detail before I touch on GT, but one of the great strengths of qualitative design, I think, is in the actual flexibility of sampling procedures in qualitative research. So sampling procedures do differ, or can differ a lot, between how we sample in quantitative research. So most forms of sampling in qualitative design, that you might know is non-probability sampling, mainly purposeful sampling, is when you actually purposefully sample participants who meet the criteria for what you actually want to look at in detail. So one would never be random sampling in qualitative research, because random sampling is associated with quantitative research. I won't get into all the different types of sampling methods in qualitative research, because there's many, but they all fall under the category of what we call non-probability sampling. And just an example there, for example, very, very relevant to us in palliative care, we think about our people who are service users, and typically service users in palliative care are considered by definition vulnerable groups, be it patients, family, and so forth. So often vulnerable groups can be hard to access, particularly on very vulnerable topics or very sensitive topics. And often the flexibility of sampling procedures allows us to access that in a way that perhaps the large-scale sampling methods in quantitative research can be more restrictive. And as I said, very useful when broaching, as I said, sensitive topics, and particularly very relevant here in palliative care to navigating beyond the social desirability answers people often give in perhaps surveys or more objective or more instruments that actually measure particular domains. So, for example, again, these are just examples off the top of my head. You know, why some people with MS have a preference for physician-assisted suicide or euthanasia. That's a sensitive topic to discuss, and one that would be explored in detail. And therefore, the why aspect of that question is what makes it suitable to apply in a qualitative design. I was just going to touch on this very, very briefly, but for those who are perhaps more familiar with qualitative design versus quantitative methods, questions around the epistemological position of the researcher are usually asked. And really what that just means is epistemology is how we all believe knowledge is created or constructed. And one of the key aspects of qualitative research is for most designs, it doesn't allow us to generalize our findings. So for quantitative researchers, that is viewed as a weakness, because quantitative researchers, the whole idea of quantitative research is that we do generalize findings to the wider population. So I think, you know, the epistemology position of the researcher in qualitative research is not just based on the research, but it's also probably based on the researcher, because I think researchers who are oriented more to qualitative methods tend to be people who are not hardcore what we call positivists, where we believe perhaps there's multiple answers to a particular experience and people have different perceptions of that phenomenon. At the same time, qualitative researchers don't have to be hardcore constructivists, and that what I mean by that is simply researchers who see themselves, who see knowledge as, or see existence as multiple realities where people's perception is everything, and there isn't actually one reality that people have experiences about. And some of the more in the areas of humanities and social sciences would be tending to be more towards more severe constructivists. But I think in healthcare and health sciences, we very much see ourselves as realists and objectivists who can apply qualitative methods. And we see in mixed methods research, which is both quantitative and qualitative used together to answer a research question, people who undertake mixed methods research are very much realists. So enough of the epistemology and ontology of research methods, but moving on towards, I suppose, why qualitative research is useful in palliative care. Well, as I said, we're interested certainly in palliative care at understanding what's going on. So understanding people's experiences or processes, which can help healthcare professionals judge better how we do things and how we deliver the interventions, and even if the interventions we deliver are the right ones. And how do we adjust those interventions accordingly to meet the service user's needs? So we're interested in exploring how that happens and why it happens. And I think what we're seeing more of also is longitudinal-based qualitative research in palliative care, where we are able to track these important changes in processes over time. So there is certainly a significant increase in palliative care literature over the last 10, 15 years, where particularly with funded studies, where longitudinal research is becoming much more prevalent in palliative care research, not just in quantitative research. Usually we've traditionally associated longitudinal research in palliative care with more quantitative research. The challenges around, I suppose, qualitative design in palliative care, I'm thinking very much because in palliative care we're dealing with what are classified people who are vulnerable groups. Both patients and family members and the wider family, they're all considered vulnerable groups for research. And I'm sure some people have heard about the reflexivity in qualitative research, which is a significant term for qualitative design. And this refers to the awareness of the researcher of his or her effects, how they're collecting data, and also analysing the data. Because unlike quantitative research where everything is controlled for, you seek to control, that is what makes good quantitative research. In qualitative research, you don't control, and that's a key difference. So the researcher is part of the interpretation because the researcher is analysing the data. It is a co-constructive process. There's wider issues, and there's been papers written on this. People have different opinions. Can data collection methods in qualitative research, given the nature of what they are, they're usually interviews, in-depth interviews, focus groups, observation. Are those types of methods more distressing for people who have life-limiting conditions? I'm not saying they are, I don't believe they are, but these are things that people have different opinions on. And does the nature of data collection in qualitative research, like I've mentioned, actually exacerbate anxiety for ethics committees? These are things that do happen. I'm a member of an ethics committee myself, and these questions do arise during a review of applications. So grounded theory, just moving on to grounded theory, it is one of the most common used qualitative approaches in research. I don't have time this morning to just even go into briefly the other ones, but if you look at the published literature in palliative care in terms of qualitative research, standalone qualitative research, a significant proportion of that is actually using grounded theory or elements of the grounded theory approach. And not to get into too much detail on the history of it, but comes traditionally from the social sciences, as most qualitative methods do, although not all. And it developed in the late 60s. And what's interesting for palliative care is the actual method came about in terms of, it developed from palliative care research in itself through, actually San Francisco, in a palliative care setting, where observations and experiences of people at the end of their life were gathered through longitudinal research, which the methods derived from that became the early writings about grounded theory. And that's in a very well published book from the mid-60s, Awareness of Dying. So it actually, GT developed from an end-of-life care population. Why do we use grounded theory as a qualitative approach over other qualitative approaches, such as like phenomenology or narrative research or case studies? It's pretty much useful when the topic of investigation is not well understood. So grounded theory is very much an inductive process. So that means beginning with data from the ground up, having very focused questions, but perhaps where the literature surrounding the questions is lacking, or we don't know enough to actually perhaps proceed with a type of intervention or proceed with developing protocols in terms of delivery interventions. So it's very much the first stage of that process. It's very useful when you want to understand very complex processes and interactions, because grounded theory as a method is all about process, which means essentially how people are acting, interacting, perceiving things in relation to the context that they're in. So grounded theory is coded for context and how people's behavior, experiences, perceptions change in different contexts, which are fluid in themselves. And also when there is realistic scope and ambition to build or develop theories. So as grounded theory in the name is the aim behind most grounded theory studies. Well, it's an aim, it's not always the actual result, is to build at least substantive theory, which means theory about the phenomena that you are investigating. So not just a description. Grounded theory goes well beyond descriptive qualitative research. It actually goes into explaining what happens, and that's what theory is. I suppose many people, unless in some small-scale grounded theory research, and particularly, you know, at PhD level or postdoc level, unless it's large funded research, most people don't end up with theory because the research has to be much more exhaustive for that. But I think most good grounded theory studies will end up with what we call an explanatory conceptual framework to explain the processes that have been investigated. I'll have examples of that in a few minutes. So I mentioned earlier on that GT research can employ a variety of data collection tools, and often people have heard of the phrase all is data. Well, that comes from grounded theory, where all is data in terms of collecting and analysing the relevance of data. But in reality, when we think about what's published in GT research, particularly in healthcare and the health sciences, it's really interviews, so one-to-one in-depth interviews or focus groups and observation, which are the methods that predominantly researchers will, in the current climate and certainly in contemporary research, use. Observation can be an issue ethically for palliative care research. It's definitely more difficult to get ethical approval on observing very vulnerable groups for obvious reasons. So you will see, you know, I mean, there's been some systematic reviews done on this where they've actually looked at, you know, in palliative care, what methods in grounded theory have actually been used to collect data or what procedures. And they are predominantly interviews or focus groups. These are just, and again, I won't touch on in detail, but if people are interested, all the references for these are at the end of the presentation. Since grounded theory developed in the late 60s, it's expanded into various schools, and these are just some of the main textbooks on the different methods. The book there, which has the number 4 on it, Basics of Qualitative Research, is the one really that is very much focused only on the techniques and procedures for developing grounded theory. Doesn't get into too much around, you know, people's epistemological position, because how different schools in GT have evolved have been dependent on that. So I would always recommend, and certainly for years back when I did my PhD and was learning about GT, this is the best book because it is the most straightforward in terms of outlining the actual techniques and procedures for doing GT. Key features, and these are features that transcend all variants of grounded theory and that define GT, I think, separate from other qualitative approaches. And that is when we collect and analyze data in tandem. So what's quite different about GT is, or ideally, is you analyze data as you gather it, which then shapes the direction of subsequent sampling. And that is, in GT we refer to that as theoretical sampling. So unlike perhaps phenomenological research or general thematic analysis, where you collect your data and you do that well, and then you analyze all your data together, ideal GT is actually, that process is one of it that happens in tandem. Logistically, it can also be more difficult to do, of course, in everyday research practices, but not impossible to have some element of that. The analysis in GT, some people I'm sure have heard of the term constant comparison or the constant comparative technique. And that is not just specific to GT, although it evolved from GT. It's simply where you can compare data against data to build theory, to build more data. And that is the inductive process versus a deductive process, which would perhaps be more along the lines of content analysis, which is a deductive process. Key to sampling in GT is, and for I suppose most qualitative approaches, is you sample for variation in your population or in the sample that you're trying to attain. And that's contrary to everything you would do in quantitative methods where you try and control for different variation. So in qualitative methods, you're always looking for some element of variation, difference within your sample, within the compliance, obviously, of your exclusion criteria. And theoretical sampling. And really, a grounded theory study really isn't a grounded theory study unless there is some theoretical sampling. It's a core element of GT methods. And that is simply where you sample in the data, more data, with the concepts that are already emerging in the data. And I have some examples of this, practical examples in a couple of slides. And as I said, GT can accommodate different types of data, but I would say interviews and focus groups are the most common methods of data collection, particularly in palliative care research when we're accessing vulnerable groups. And the key difference, I suppose, between GT and many PhD students will say, well, what's the difference between GT and other qualitative methods? If I were to say beyond theoretical sampling, it's actually you're developing, or you should be developing a conceptual explanatory framework that is explaining the process that you're investigating. So not just describing, but actually explaining. So GT is all in the explanation. And that's the key difference between perhaps general thematic analysis, which doesn't explain but rather describes. So for example, a question might be, again, how do men with end-stage cardiac failure negotiate the decision-making process surrounding DNR? That's a question that is how. So that is a question that is very suited to using GT methods to answer and explain that process. The researcher is, in GT, very much part of the interpretation. So I alluded to that earlier in the presentation. Unlike quantitative methods where the researcher isn't part of the actual interpretation of the data because that's controlled for, there is a significant interpretive element to grounded theory as there is to other qualitative approaches. And one of the key strengths of GT, in terms of the fact that it is where data collection and analysis happen in tandem to a degree, is it allows for greater flexibility in terms of reorientating the questions that need be. Often you'll find in a GT study that you may start off with a very short, open-ended number of questions in your interview guide, but as a GT study proceeds, those questions do change, or should change, based on the data that comes in your early phase data collection. And there is an expectation that your questions in your interview guide, if you're using a semi-structured interview guide, they will alter in time as the study proceeds to some degree. Memoing is a very important procedure, an analytical procedure in GT, because it's a way of documenting how one is analyzing the data as you're building your explanatory framework or your theory. It does differ to general field notes, which is a part of the general data collection methods in qualitative research, where a researcher would normally take field notes. So memoing in GT is very different from that. And not to get too complex, but grounded theory analysis really is a combination, when we talk about interpretation of the data by the researcher. Whilst it's primarily inductive, there are also elements of abduction and deduction when you're developing an explanatory framework or theory. This is just a quick example. Again, it's an article that I wrote a couple of years ago with colleagues in social sciences and social policy who also use GT method in different types of studies. And we wrote this it's open access, so it's available free in the International Journal of Qualitative Methods, where we just, very pragmatic paper, where we explain the key elements of GT, regardless of what school or variant of GT you are using, and what makes a GT study and what doesn't make a GT study. So again, it's open access, so it's freely available to everybody. And it's a good grounder for people who are probably setting out on doing a GT research at least a PhD level or beyond. And the key core principles of GT are taking the word grounded seriously. So the data has to be grounded in people's experiences, okay? You set out to explain a process, not just to describe it. And that you do have to at least have the aspiration to develop theory, or at least a conceptual explanatory framework, if there is no framework at the end of a GT study, it's probably not a GT study. And also there has to be an element of theoretical sampling, because without theoretical sampling, it's very difficult to get to a point where you actually arrive at an explanatory framework that's based on the data that has emerged. I won't go into such detail here because, again, this is probably for those who are already very familiar with GT, but there are just key elements key steps in the data collection process around coding and labeling of data, which do differ a bit to general coding procedures in other qualitative methods. And for those who are doing PhDs at the moment using GT, you're probably coming grappling with this, and this is a steep learning curve in that phase of using GT in a qualitative in a study. But the key elements of it are coding for process, key incidents, events and behaviors in the data, which give you concepts. Larger concepts become categories. And the explanatory framework comes out from explaining the relationship between these concepts and categories. And the end stage of a grounded theory research is refining the categories and the relationship between them, which is actually what builds or develops a conceptual framework. There are some myths around GT, which in the paper that the open access paper there, that we kind of dealt with. The traditional GT researchers often say, well, you can't engage with other literature. That's incorrect. A GT study doesn't always produce theory. That's correct. And data collection analysis must always happen in tandem, ideally, but obviously in research, in terms of the pragmatics of doing research, this is not always possible. Often in research, particularly at a PhD level, you're happy to get participants once they meet your inclusion criteria. So it is possible to analyze chunks of data before you theoretically sample. There's also the misperception that coding in GT, as opposed to coding in other qualitative approaches, is much more time-consuming. That's not the case. It's coding in qualitative data analysis in the early stages of qualitative projects is time-consuming in general, but GT is no more time-consuming for that. This is just an example of a paper. Again, it's actually it's not an open access paper, but if you have access to PubMed, you will be able to access it freely. And it's a paper I wrote some years ago, a number of years after my PhD, with the person who actually supervised me on my PhD, where we wrote the paper to basically spell out the basic components of GT, and I used my PhD study to actually, with examples of how it was applied in a grounded theory study to capture healthcare experiences. So again, it's a very instructive, pragmatic paper, which is aimed at facilitating people who are beginning to familiarize themselves with GT at a minimum PhD level. This is an example of a conceptual explanatory framework that I mentioned a few minutes ago. This came out of that study, which was the study started off with a very general question around how do people with MND or ALS engage with healthcare services? And because not much had actually been known about that or had been documented in detail, certainly nothing around a conceptual framework. And these are when the findings were mapped. And as you can see, it's an explanatory framework, which is capturing concepts, loss and control, and what makes those concepts up. And then to the right of that diagram, you can see an explanation of what is happening with people and what they're doing. So that's what we refer to: behaviors, experiences, and instances. And then why people behave in certain ways. So this is an explanatory framework which came from some of the findings of the study and was published some years ago in Social Science and Medicine. So as I said, when you're reviewing a grounded theory paper, you're usually looking for somewhere in the paper that there is some explanation or diagram of an explanatory framework. It sort of is a red flag if there isn't. This is just some brief example of what I mean about coding, and again, I'm just going to cover this quite briefly. Another paper which came from the study published in QHR some years ago was issue around, again, acceptance and decision-making, which through the study emerges very much as a life course issue for people. So people were very much making decisions around their care based on a life course perspective. Nothing had ever been thought about that, and indeed at that point, or certainly published a lot. So this was very much inductive findings, and they were novel and new. But just to give you an example of what I mean about the different stages of open coding. So for example, in this study, in the early phase of the study, perhaps in the first 10 or 11 interviews with people, there was definitely patterns emerging across the data, across participants' viewpoints, where there was this emphasis on reliance on family. Many codes were similar, and they became categories. So categories such as reliance on family. And in other parts of the data, there were also different codes, which was around family reassurance. So many codes would have, formulated these categories. So in GT, the emphasis during the data generation and the developing theory is to look for relationships between these concepts. So as you continue to collect data, so for example here I would have looked at relationships with what was the relationship between reliance on family and the concept or the category of family reassurance. So as I continue to collect more data, I ask questions around that in subsequent questions in the subsequent data collection phase. For example, an example of a theoretical memo here would have been, is feeling reassured a consequence of having family to rely upon? Or does family reassurance mean more than just feeling reassured by family support? And this is the theorizing that the researcher does. So I sample for variation in these contexts for more information on this. So for example, I interviewed people who were at different life stages, who were at different life stages or had no immediate family or who varied in their family responsibilities. And by doing that, and by going to people in those contexts and asking those questions, more findings came from that. And the key finding here was that family context to reassurance and M&D also included how people themselves rendered support and were of support to their family, which kind of shifted that whole dynamic relationship between the patient and their family or family caregiver. So again, that's just a very, very brief example of how one goes about the different coding phases in GT, but they are detailed more clearly in that paper that I referenced there. This is just a paper that's come out recently. I wrote with colleagues in social work, social policy, and social sciences. And we use, it's a very pragmatic paper, just published in QHR, about how to theoretically sample in GT. There is a bit of a misperception that theoretical sampling is impossible to do or very complex. It's actually not. So when you actually become clear what you're trying to do, it is a different type. Theoretical sampling, for sure, is very different to purposeful sampling. So we wrote a paper, and we have 5 different sections in it where we just give practical examples, 5 different studies where we actually show how we theoretically sampled, and we explain it in really, really clear terms. So it's very much an instructive or didactic paper, again aimed at people who are perhaps at the stage of doing a GT research, a piece of research, and beginning to theoretically sample and to understand that better. Unfortunately, it's not open access, so it was quite expensive, so we couldn't afford that. So using GT in palliative care research, what are the benefits and challenges? There's always challenges, as there is always benefits. So might restrictions such as ethic boards, sourcing palliative populations in themselves, which are difficult in themselves, the time restrictions. Might that restrict theoretical sampling? For sure. That is a challenge, but I think it's a challenge for palliative care research, particularly when you're assessing a vulnerable population, regardless of the method you're using. But theoretical sampling is not just about sampling for more participants that meet a certain criteria. You can actually theoretically sample for concepts in data without actually generating or recruiting more participants. And it's flexible. Sampling in GT is quite flexible, as I said. It's not the case that, one does an interview, analyzes, does the next interview. You can actually analyze large chunks of data depending on the nature and the pragmatics of how you're conducting your research in between. So we speak to those issues in the paper also, in terms of actually the pragmatics of doing GT research in general, not mind just palliative care. And there is certainly observation is a common method used in GT, but it is more challenging to do that in palliative care research if the research participants are considered vulnerable. So there is a reason perhaps why most research conducted now in palliative care is perhaps the data collection methods tend to be focus groups or one-to-one interviews. Not impossible by any means, but it is more challenging to get that through ethics committees for sure, from my experience. But one of the advantages again of GT is that it accommodates to other forms of data, not just interviews and focus groups. So all is data in GT research. So again, the benefits and challenges, I think for me, GT, its ability to capture and explain people's experiences and perceptions that are grounded in their viewpoint. So like most qualitative research methods, and GT is no different, is everything is based in the perspective of the participant. So it is the participant who we consider to be the expert of their own experiences, perceptions. And that is probably a key difference between qualitative research and some quantitative methods that we use. And if we're investigating experiences or processes that are grounded in both the context and people's perspective, well then surely it helps us as researchers or healthcare professionals who deliver interventions to know what care outcomes therefore are important for people based on their own perceptions and based on their own experiences of navigating palliative care services. So I think this is a key strength of using the GT method. If you understand why you use it and how it's different to other qualitative methods, and we're very much invested in treating the patient and the family caregiver or family as the unit of care, as the central aspect of their care, then GT methods, in terms of the process of GT, is very relevant, very useful, I think, for vulnerable groups in palliative care research. So because our focus collectively is always on patient-centered care. That's what matters most. And thank you. So these are just the references at the end. I have referenced every reference there that I alluded to in the presentation, just for further reading, if people are interested or maybe thinking about doing a grounded theory study, or simply wanting to know more about the grounded theory method. And that's it.